Did you know that for many Americans, the number one concern they have about retirement is healthcare costs? In this video, we'll tell you why that is, and we will show you how to avoid healthcare costs completely derailing your retirement plans.
We're Mike and Shannon, and we're the founders of Healthcare Genius. For the best information on retirement and healthcare, subscribe to our channel and click the bell for future notifications of upcoming videos.
For many people, healthcare is actually the number one cost that they have in retirement. Many people think that when they retire that their healthcare will actually be cheaper than it was while they were working, but for many that's not the case. We're going to tell you why that is and what some of the major concerns people have about retirement and healthcare are. We're going to tell you what the misconceptions and the challenges are about healthcare costs in retirement. And first, in order to do that, we're going to talk about the issues with Medicare itself. Now, one, it's complex, and you probably already knew that. It's hard to understand. It's hard to figure out how to enroll, when to enroll. There are actually penalties that are associated with not enrolling at the correct time. Another thing that you did probably know is that there are many different parts to consider, and you have to think about all those parts and what's right for you. I also do want to point out that Medicare is not free. It's actually can be pretty expensive, and the costs have continued to rise from year to year. Over the past 50 years, Part B premiums alone have risen about 7.5% from year to year. Part of the issue here is the sheer number of baby boomers who will be eligible for Medicare. There just aren't enough Gen Xers who will be paying into the system. One way to think about this is that years ago, when Social Security first started, there were approximately 35 workers supporting each retiree. Today, there are less than 3 workers supporting each retiree. So at the end of the day, there are just not enough people that will be paying into the system.
So now, as we mentioned and talked about the premiums that you pay to the government, we haven't talked about all of the costs that you might incur for Medicare outside of what those premiums are. Because as Shannon mentioned, Medicare isn't free, and it also doesn't cover everything. So as an example, if you were to have to go to the doctor and you only had original Medicare, you potentially would be paying 20% of the costs of what that doctor visit would be. So most people look at purchasing one of two major kinds of plans. One is Medicare Advantage plans. Those are becoming a lot more popular. Matter of fact, I believe in the latest enrollment, almost a third of Medicare enrollees signed up for a Medicare Advantage plan. That's essentially where the government is paying a private insurance company to take on the responsibility of Medicare. You've probably seen a lot of ads for Humana or Kaiser or United Healthcare, AARP. Those are typically Medicare Advantage plans. And you're going to pay zero premium for a lot of them, although some do have nominal premiums, $40, $50. But they don't cover everything like you might be thinking. So for instance, you might be paying a copay when you go to the doctor, or you might pay a copay when you have to go to the hospital, and those can be per day. In most cases, the out-of-pocket is somewhere in the $3,000 to $5,000 range. So that's the worst-case scenario that somebody could be paying. So those are Medicare Part Advantage plans. It's called Part C. A lot of them also include prescription drug coverage, which again will have co-pays for most of those plans. If you stick with original Medicare, then most people, because it doesn't cover everything, would sign up for a Medicare supplement plan. And those are all known by alphabet names. So those plans will pick up some, if not all, of what Medicare doesn't cover for hospitals and doctors. They do not, however, cover prescription drug plans. So if you sign up for one of those plans, you would also have to buy a separate prescription drug plan. So when you add all of that up, these can range anywhere from $100 a month upwards of $160, $170 a month, depending on where you live, for the supplemental plans. And then prescription drug plans can range anywhere from $20 upwards of $100 a month. So when we talk about premiums, it isn't just that coming out of your check, but it's those other costs as well.
So if you're like most people and you're surprised by a lot of this information, feel free to comment below and let us know your thoughts. Now that we've gone over some of the different parts of Medicare, let's talk about what Medicare doesn't cover. Most people don't really think about the additional things like vision, like dental. And the reality is, once most people get older, once you hit that age 65, you're gonna need those things maybe more than you did while you were working. And so it's important to be thinking about not just what are your costs gonna be in terms of Medicare, in terms of maybe some additional pieces that you might be buying, but what are your costs gonna look like when you have to buy individual dental or vision insurance? Another important piece to think about is hearing aids. Most people need hearing aids when we, again, hit a certain age. And so when you're thinking about your costs, it's important to think of everything that'll go into your healthcare costs. So the last piece that we want to talk about that's really important is long-term care. Now, if you don't know what long-term care is, think about the types of things that you'll need generally when you're older. So nursing home care costs, in-home care if you need to have somebody come into your home and help you out with different things. Those things are not free and they're not covered by Medicare, which is what a lot of people don't realize. Now, none of us like to think about when we get old and when we might need these things, but the reality is over 60% of people in the United States are likely to need a long-term care service at some point in their lives. And again, we don't like to think about when we're getting older, but it's not always about just when we're getting older. People are starting to get dementia and Alzheimer's younger and younger, unfortunately, and long-term care services are oftentimes required for those individuals, again, not covered by Medicare. And it can get really expensive. For a nursing home with a private room, the average cost this year is almost $100,000. It can get really expensive.
Yeah, Shannon, it's a great point. And another area that people forget about when it comes, if we wrap all of this up and put it together, are taxes. When we're working, we have this great benefit if we have an employer that's called a Section 125 plan, which allows us to pay our share of healthcare premiums, dental, vision, medical, on a pre-tax basis. So that means we save not only FICA tax, which is 7.65%, but we also save whatever the state and federal tax is in our specific state. So those add up. I mean, they can be anywhere from 30 to 35% to 50% or more. So one of the things that you really, again, have to worry about is that when you're retired, you're not going to get that tax deduction for most people. To get a tax deduction for medical expenses, you first have to itemize, and then secondly, the first 10% of whatever those expenses are not deductible. So as an example, if you had $100,000 in retirement income, then the first $10,000 of medical expenses would be not deductible to you, and anything over that would be. So you can see where it gets pretty tough to deduct your medical expenses when you're retired. One reason that a lot of people really don't understand the whole tax point is that our parents and grandparents, a lot of them had pension plans that they received from their employers that they work for. And the other thing that used to be is that employers used to pay for health care. Actually, a lot of governments, including the federal government, a lot of state and local governments, continue to pay healthcare costs for their retirees. This is a huge bonus to those individuals because they're not taxed on the benefits that they're having to pay for those costs. So just something to understand if you're saying, well, how come I didn't know about this, or how come nobody told me? It's because a lot of times people just aren't aware of the issue.
So now that you know why people are stressed about it, you know why it's important to plan for it. If you're still confused and you need some advice on planning, please go ahead and visit our description and click the link to become our client. And don't forget to subscribe and click the alarm bell to keep up on what we're doing.
Great, thank you very much. Have a great day.